Namaskar, Johar. My name is Dr. Nirav Patel. I am MS General Surgeon and I am practicing in India's smallest tehsil, Khairgaon, which is situated in Navsari, southmost district, one of the, and it's in Gujarat. Uh, there are only two major hospitals and one government hospital, and very lack of facility and very remote and tribal belt. As I'm tribal, I selected the area to serve and to work. After passing out, actually I wanted to be a neurosurgeon, and in first attempt I was getting plastic surgery and pediatric surgery, but my other colleagues choose to read. But I thought at that time that after completing MCH, I have to stay in bigger cities, at which my parents don't want to come. As I told them, you should come along with me to stay in Ahmedabad, but they refused, and they said that we have been so here since a long, so we are not coming. That's why I decided to stay with them, and I decided to come back to the our remote area. Actually, I am an agitator and I am an Andolankari, and we are fighting for water, land, forest and environment, and against the destructive some policies of government. And we are fighting since 8 years, since I established my hospital at Khairgaon. So there is every day meetings, and there are lots of patients during daytime, and there are meetings in evening. So was not possible to come at that time. So frankly say, I called the Sailja, and my manager called the Sailja, and I asked that if possible I return my money, as I cannot able to come here. But it was the most faulty decision, I think now. And for coming here, I thought it is 14 days. Let's चलो हो आते हैं, निकाल देंगे किसी ना किसी तरह से 14 days. Actually, I passed out in 2015, and I secured the gold medal in Gujarat University. And after 10 years of after leaving the education line, and after establishment of 8 years of hospital, I thought it would be very difficult for me to sit in the lectures, how I could study, how I could be a student after 10 years of passing. But everything, when I came here, since the first day, I met Dr. Chauhan sir. He was, and he is, and he will be tremendous and excellent, and he is always smiling. I and Abdul, my colleague, both are asking so many questions to him, lots of questions. But he never become angry, or never become he doesn't think that don't have to answer. Our questions can be beyond the course line, but he has the knowledge of everything. I can say he is the one of the most intelligent teacher I have ever met, and he has given not only the knowledge of laparoscopy, he has given lessons of life also. He is knowing, he is giving lessons of maths, he is giving lessons of physics, chemistry, physiology, biochemistry, pathology, surgery, he covered almost all aspects, and we continues to ask. I and Abdul always talk after completing the class how much we are asking the questions, and all the Narin Sehgal sir and Abhiyanand sir or Anand Singh Kushwaha sir and Manoj Kumar sir and Dhingra sir, all they taught us beautiful lessons. Dr. Alka Jain madam also given beautiful lessons, and we are sincerely giving thanks to our SMASTI's coordinator, particularly Santoshi, who is always standing with me and giving a very good lesson. I always praise him that you are also become a good assistant teacher with staying with Dr. J.S. Chauhan sir. And all Sailja and Dilip joined today, and Renu also very good. They are always smiling, and they are never be angry or never be pathetic, never give pathetic response. And OT staff, Siv Bhais and everyone, so much calm and so much happy, so much happier and so much. What I can say, they are very cooperative, and never they are thinking that we are newer, and we have seen many places that senior OT staff or senior consultants are treating newer person very harshly, or they think that you are newer, why we should respond. But here everyone is excellent, and I 3 days back I told about harmonic scalpel and ligashore. Then I talked Chauhan sir that it's not our capacity to buy such costly instruments, and wish we could buy in future. Then Dr. Chauhan sir given an example of Dr. Sehgal sir that it was also hospital started from 10 beds to now such a big institute. So we have also faith that we can be such a pioneer of such an beautiful institute. After getting admission in this course, I am confident and I have faith in myself that I can be a good laparoscopic surgeon also in future after practicing, and I can serve the people. Otherwise, till that, before coming here, I was thinking that laparoscopy and getting new education and getting newer techniques is not in my level, because since 8 years I am practicing open surgeries, and I haven't exposure of laparoscopic surgery in the past. So after completing 10 years of education, it would be difficult for me to get a laparoscopy education. But now I can say I will get the I am getting a good lesson, and thanks a lot all faculties, particularly Chauhan sir. You are outstanding and you are awesome. Thank you. Have to say many things, and thanks to canteen people also. They are serving very good food. Particularly that girl, don't know her name, but she is also good take caring. And many all staffs, I should say thanks, and again Johar and thanks to all for such a tremendous and such a beautiful experience and exposure given to us. Thanks a lot.